Hello, my name is Truitt, and I'm presenting on diagnostic disparities in autosomal dominant polycystic kidney disease, or ADPKD. ADPKD is the most commonly inherited kidney disease and is primarily caused by mutations in the PKD1 or PKD2 genes. Disease severity can vary widely, and many individuals remain undiagnosed until later stages of the disease, when kidney damage has already progressed. Because treatment options are limited, delayed diagnosis can contribute to worse long-term outcomes, including kidney failure. The purpose of this project was to examine diagnostic disparities in ADPKD, with particular attention to how genetic complexity, delayed recognition of early disease, and underrepresentation of minority populations in research contribute to inequitable diagnosis. For my methodology, I conducted a literature search using PubMed and PubMed Central. The search focused on ADPKD genetics, disease progression, and health disparities. Studies were included if they addressed genetic mechanisms, epidemiology, or diagnostic disparities in ADPKD. The articles were then organized and summarized to identify recurring findings and gaps in the literature. Across the studies reviewed, three major themes emerged. The first theme was that genetic complexity can act as a diagnostic barrier. So ADPKD diagnosis relies heavily on the identification of PKD1 and PKD2 variants. However, patients can still have ADPKD due to variants in other genes. Because most studies focus primarily on PKD1 and PKD2, individuals with less common variants may remain undiagnosed until the disease has progressed further. Additionally, PKD1 associated disease is often more severe, and genetic ambiguity can complicate early diagnosis, particularly in underrepresented populations. The second theme is that ADPKD is detectable early, but still often missed. Early disease changes may be biologically reversible, which highlights the importance of early diagnosis. While imaging tools exist that can help predict disease progression, they're not widely used in clinical practice. So as a result, delayed diagnosis limits opportunities for early intervention. The third theme involves documented diagnostic disparities. Most genetic and imaging studies are based on predominantly white cohorts, so as a result, Black and Hispanic patients are more likely to receive a diagnosis at later stages of disease. These disparities are more evident at the stage of kidney failure rather than early disease, suggesting that there is an under-recognition of ADPKD in earlier stages among minoritized populations. In conclusion, this review highlights significant gaps in the literature related to diagnostic disparities in ADPKD. There is limited research focused on racial and ethnic disparities, as well as underrepresentation of women and other minoritized groups. Additionally, there is a lack of standardized diagnostic criteria across healthcare systems. So overall, these diagnostic disparities may contribute to worse long-term outcomes, and further research is needed to support earlier and more equitable diagnosis. Thank you for listening.